Hello friends, welcome to Easy Nurse, where nursing education made easy. So, as your exams are coming, in this session I am going to discuss about the most important topics of community health nursing. So whoever is not prepared for community health nursing, you can just watch this session or go through this session, okay? And I will explain each and everything, okay? But also I will not explain in very much detail. I will keep the point wise description so that you can remember it in your exam and you can appear it well. Okay, so in community health nursing we will discuss about the community health nursing programs, the community health nurse, and about the health education that a community health nurse give in a community health area. Okay, so let's get start with our session without further delay. Okay, so first we have to know what is mean by community health. So by this word and all, we can understand, okay, it is something related to community and the health. So the community health is the art and the science of maintaining, protecting and improving the health through the organized community efforts. Organized community efforts in the sense, the efforts that we do to improve the health, like healthcare services, the maintaining the hygiene, okay, and coming with up the records and entering or documenting the records and reports of the cases, okay, or health related cases that happened in several areas. So let's see what is the dimension of community health. So community health have physical dimension, mental, social, spiritual, vocational and environmental dimension. So physical dimension mainly told about the absence of the disease, where the mental dimension will tell about the emotional and psychological well-being. The social dimension is to maintain the meaningful interpersonal relationship and interpersonal relationship, okay, with their own family, with their own, and with also the society. The spiritual is the sense of purpose and meaning of life, where the vocational one is the satisfaction from the work and well-maintained life or well-balanced life with the work. Lastly, the environmental, which is actually for the clean, safe and surroundings. Okay, so these are the dimensions of community health. Let's move on to the determinants of health. So what is mean by determinant? Determinants are the factors, okay, or the points which will be determining or which will be defining how your health will be. Example as biological, which include age, sex, genetics, gender, okay. Then behavioral, which include lifestyle, your behaviors, okay, habits, moral ethics and all. Socio-economical is the education and the income, whereas the environmental determinants include housing, okay, sanitation, pollution, this. And lastly, healthcare services include availability, accessibility of the healthcare providers, or you can say healthcare system. Okay, so these are all the determinants of health. So as a community health nurse, okay, we have to know what is mean by community health nursing. So the concept of community health nursing is derived from a field of nursing that combines public health and nursing to provide the care of the community setting. So if you see in a public if you see in a private hospital, we are giving care to the individuals, right? Different individuals. But in the community health settings like CHC or PHC, if you see, so at a single time we are providing care to many of them. We are providing education, we are providing healthcare, facilities and all, medicines, everything. So that is the main concept of community health nursing. Let's move on to the extremely sorry for that. So next move on to the philosophy of community health nursing. So philosophy of community health nursing is actually based on the fundamental rights of the community health nurse and the moral and ethics of the nursing, which will be following without hurting the community guidelines. Next is, it is also focus on the prevention and the health promotion. So as we know that prevention is better than cure. So if you are treating a person, it's not easy, but still it is okay. But if you are treating so many people, or you are treating people in a community all together, at that time it will be very difficult. Okay, so what we can do, before getting the disease, we can prevent it through the health education, prevent it through the spreading of awareness regarding the disease and all. Okay, so that is focus on prevention of health promotion. Next, move on to the community participation. Okay, so see, whenever you are going in a community and giving a proper care and all, at that time you should always, encourage people to participate in that program. If you are doing a health camp at that time, okay, or if you are going for a normal regular surveying and all, so community should always actively participate in that program or in the work. Okay, at that time only you will able to collect the proper data from them. Okay, next one is principles. So the principles of community health nursing include equitable distribution of the healthcare facilities, prevention over the cure, intercoastal coordination between the team members, okay, and the healthcare teams, community participation, and appropriate technology while doing any kind of procedure or providing any kind of care. Next one is characteristics. So what are the characteristics of a community health nurse? So it include work in home, school or workplace. It also community health nursing also emphasize the family and group care, long-term relationship with the community, and more preventive and more promotive care. So this is all about the community health nursing. Next, we'll move on to the role. So as a community health nurse, what are the main roles that you have or that you have to play in a community while providing the care? So first of all, we have to conduct the community survey and need assessment. Okay, so see, if you are going in an area, okay, where you have posted as a community health nurse, so to understand the area well, first you have to do a survey of the family, okay, their health history, okay, and all the data you have collected, you have to arrange it properly, and you have to look for, or you have to investigate for the cause that is actually affecting the health of the community, or that is actually causing the disease. Okay, so for that we have to conduct a community survey, and then it needs assessment. Next, identify the health priorities. So if we are seeing, if you are as a community health, you are nursing, you are going in an area, okay, and you are observing, okay, this many peoples are getting cold too much, okay, in between 1 month and 1 month they are getting cold. So how they are getting, or they are getting fever, how it is happening? So after assessment or all, after talking with the doctor, community health doctor, okay, or physician, you came to know, okay, because like it is the viral infection that is continuously spreading. Okay, at that time what you will do, you have to identify the priority. So for this, to avoid that particular viral fever and all, you have to tell the patient to avoid cold, to maintain the hygiene, and to use proper personal protective equipments while they are sneezing, coughing, okay, or any person who have the infection. Okay, so we have to identify the health priorities, then participate in planning health program, assist in budgeting, resource allocation, okay, to conducting any kind of program or any kind of health camp, we have to do a budget planning and resource allocation. Then collaborate with the local leaders, NGOs and all, so that you whatever the care you are giving, it will be up to the mark. Okay, then implement and supervise the health programs, monitor and evaluate outcomes, and lastly to educate the community on the health rights and service. So these are the roles of a community health nurse. Next, move on to the environmental factors that affecting community health and the community health nurse role. So what are the environmental factors that actually affecting a community health nurse work or community's health. Okay, so different types of pollution such as water pollution, air pollution, noise pollution, poor sanitation, inadequate housing, and vector breeding are the most most common and most vulnerable environmental factors to affect the community health and community health nurse role. So what we have already seen that what are the community health nurse roles or CHN's roles are, but in the cases of where actually the environmental factors are actually the reason of the disease, in that cases as a nurse what we have to do, we have to assess the environmental risk, educate on safe water, hygiene and waste disposal, promote the environmental sanitation, collaborate with the authorities such as sanitation department, and lastly we have to report the hazards to the public health authorities if it is very much needed. Okay, our next topic is solid and liquid waste management and health effects of poor sanitation. So as we know, in an area where environmental health is very poor, in that kind of area we have to manage the waste. Now how we will manage the solid and liquid waste? To manage the solid waste methods, first of all we have to do a proper collection of solid waste. Okay, there should be different waste like infected waste or hospital waste should be collected differently. Okay, household waste which can be decomposed, okay, in the soil or buried in the soil and it will be dissolved with the soil, that which is called also as biodegradable. Okay, biodegradable waste, biodegradable waste and non-biodegradable waste. Okay, so in these cases we have to differentiate the waste and we have to collect it thoroughly. After that we can go for different type of solid waste management such as composting, okay, which I told, biodegradable waste that we can bury inside the soil. Okay, then incineration, which is actually burning down, landfilling. Okay, we will be digging some pots in the lands and we will be burning all the waste products and again we will cover it with the soil. Then recycling, in the recycling or the product that can be reused like metal products, or if it is a plastic products, okay, or it is a glass product that we can reuse. Okay, we can sterilize it, we can sterilize all the things, we can melt it down and again we can use it for other purposes or we can make other things. Okay, so that is come under the solid waste management. Next is liquid waste disposal methods. So we can use the liquid for the liquid waste disposal we can use septic tanks, which is usually used for the bathroom waste and all. Okay, then sewage treatment plants, soak pits and biogas digester. Okay, so these are the liquid waste disposal. Next is health effects on poor sanitation. So in a area where the sanitation is not maintained properly, in that kind of area different kind of problems can come. So what are the health effects of that? It can cause diarrhea, cholera or typhoid, waterborne diseases, vector-borne disease such as malaria, dengue, environmental pollution, skin and respiratory infection. Okay, you guys are understanding, right? If you don't understand, you want to ask any question, you can ask me in the comment section. Okay, just do not hesitate, ask any kind of doubt. Okay, so our next one is nutritional assessment method in community. So why nutritional assessment is needed? So see, if your community where you are working, you want to assess the health, first you have to see whether they are consuming the proper amount of nutrients. Okay, so we have macronutrients and micronutrients. The macronutrients will include carbs, then fat or we can also say lipid. Okay, along with that vitamins, minerals, water, and most important one is protein. Okay, so these are the 6 essential nutrients that we need. So for this nutritional assessment, what are the methods that we have to do? We have to go for the anthropometric, which is height, weight, MUAC and BMI, body mass index. Through this we can understand as per the proper gender or sex, age, whether the person height, the weight or MUAC or BMI is correct or not, normal or not. Okay, then biochemical. In the biochemical we will see the hemoglobin, serum protein, CBC test and all we can do. Then clinical, we have to look for the signs of malnutrition. Okay, malnutrition is not decrease of nutrition, it can be increase or more than normal nutrition also. Example as edema, hair changes, okay, body shape changes and all. And for the dietary, 24 hours recall food frequency is questionnaire. Okay, then functional tests such as grip strength, physical activity levels. Okay, through this kind of test we can actually assess the nutritional method in the nutritional assessment method in the community. Okay, next one is community health nurse. Community health nurse role in nutritional assessment. So as a nurse we have to identify any kind of risk such as children or pregnant women are going through the nutritional problem or not. Then we have to go through the monitor of growth and development of the child. Okay, then refer the malnourished cases such as kwashiorkor, marasmus, okay, or protein energy malnutrition, or cases of anemia or any kind of vitamin deficiency or mineral deficiency cases. Okay, we have to refer it. Then we have to educate the families on the balanced diet, not only include carbs, include protein, fat, everything it should be balanced. Okay, also it should the meals of the children have to be include, and for everyone also include vitamins and minerals in a proper amount. We have to support the nutrition programs such as ICDS and vitamin A prophylaxis program. So these are the nutritional assessment. Next we will move on to the plan of nutritional education session for a mother and a malnourished child. Okay, in the rural area, the main intention is to improve the maternal knowledge and practice related to child nutrition. The target group will be the mothers mother of under 5 children in the rural areas. Where it can be happen, or the venue will be Anganwadi or community halls. The duration will be not more than 45 to 60 minutes. Okay, so how we have to do, or what is the main things we have to do? First we have to do a basic balanced diet plan for the mother. We have to teach the importance of breastfeeding and weaning. Okay, weaning in the sense after the age of 6 months baby the mother should try to feed different types of food along with milk. Okay, and gradually the mother will feed only the food, okay, not the breast milk. Okay, so that is importance. So this importance of breastfeeding and weaning we have to teach it to the mother and their family. Locally available low cost nutrition food we have to provide. Then hygiene in the food preparation we have to tell them to maintain, and we can also advise them to prevent of PEM and micronutrient deficiencies by providing some nutritional supplement if it is possible. Okay, now there are different types of teaching methods, okay, through which we can teach a health education to the mother and the community. Okay, we can teach it through charts, posters and all. We can do through food demonstration, group discussion and question and answering, then role play or skit on child feeding. Okay, so through this we can teach the mother and the community. Now for the follow-up plan of this kind of things, what we can do, we can go for home visits, we can, or for the reinforcement, we can go for growth chart monitoring of the particular child. Then we have to link with the ICDS services so that we can get the proper data, okay, proper present and past data of the children and the family. Next is describe the healthcare delivery system in India. So healthcare delivery system in India refers to the organized network to provide the healthcare system to the public, okay, and the private health services provided at 3 levels, okay. So public and private, both levels are divided, actually provide the care in 3 levels, okay, primary, secondary and tertiary. That this is mainly aimed to promoting, restoring and maintaining the health of all of the citizens, okay. For the primary health care, the institutions are sub-centers, okay, and primary health centers, okay. So we have 2 institutions in primary level of healthcare, which is sub-centers and primary health center or PHC. So what are the staffs it will have? It will include health worker, male and female, ANM stars or auxiliary nurse midwifery, medical officers at PHC and MPW or multi-purpose workers. In after this also some workers, like there will be a man will be there to wash clothes, then security guards, okay, the lab technician, these persons will be there, okay. So what is the main function of primary health centers? So the main functions are maternal and child health services, immunization, okay, family planning and contraceptive services to provide an education during regarding the sexual health and how to use the barrier method and all, okay, treatment of minor illness, health education and awareness, control of locally endemic disease, record keeping and vital statistic collection, okay. So these are the function and the services that are given in the PHC system. The next one is secondary level of healthcare. So these institutions include CHC or community health centers and district or subdivisional hospital. The staffs include with medical specialists, staff nurses, pharmacists, lab technician and many more, okay. So in there it will mainly provide the act as a referral units of PHC and SC. So when the person is not well or properly treated, or the situation cannot be handled through the PHC or SC, then it will be referred to the secondary level of healthcare, like in CHC or district hospital. So it provides a specialized care in the medicine, surgery, pediatrics and OBG. OBG in the sense obstetric midwifery and gynecology. Also with that we will give we can give in the centers minor surgical procedures, inpatient care with the bed, emergency and obstetric care, and lastly diagnostic and laboratory services. Lastly, in the tertiary level of healthcare, the institution will include medical colleges, okay, government medical colleges, super specialty hospital like AIMS or PGI, then regional, state or national apex institution. So their main function is for the advance in specialized care such as neurology, cardiology and oncology, management of complex health condition, okay, which are not usually handled through the CHC, okay, such as difficult heart conditions, cancers, okay, or difficult surgeries. Then management of complex health condition, this I already told, okay. Next one is teaching and research activities, training of medical and nursing personnel, policy planning and health program foundation, okay. So this is the tertiary care. So what is the difference between the public and private sector contribution in the healthcare delivery system? So for the public sectors, it offers the affordable, equitable service via the national health program, whereas the private sector complements the care, especially in urban areas, but it may be very costlier. Okay, the linkage between the levels of the healthcare system is sub-centers, okay, are under the PHC or primary health centers. Primary health centers are under the CHC. Okay, just 1 second. Yeah, primary healthcare centers are under the CHC and the CHCs are under the district or tertiary hospital. The referral system ensured the stepwise care and proper reassure utilization. If it is not treated in sub-center, it will be referred to the PHCs. If PHC also not been treated, then it will refer it to the CHC, and from the CHC it will be referred to the district or tertiary hospitals. Okay, so this is the linkage. Now, what are the key national schemes which enhance the healthcare delivery system? It include Ayushman Bharat Yojana, okay, PM or Prime Minister Jana Bharati Yojana or Ayushman Bharati Yojana, okay, which is a cashless insurance and health and wellness centers. The National Health Mission, which will strengthening SC, PHC and CHCs. Then Janana Suraksha Yojana, which will save motherhood promotion. Okay, next one is communication in CHN, okay, or community health nursing. So see, communication is a process where we will be receiving information. Okay, so communication process includes these components, which are sender, message, medium or channel, receiver and feedback. Sender is the person who is sending or initiate the message. Message is the information that is passing through from one person to another person. Okay, this is sender, receiver, message, whatever the information the person is trying to pass. That and the medium and channel will be like through which he is or she is convincing. So that will be verbal, written, or it can be gesture as well. Okay, so the receiver is the one who is receiving the message, and feedback is when he will understand, he will again give a feedback. So that is feedback. Okay, but there is a different types of barrier in the community health nursing while doing the communication, such as language barrier, cultural difference, poor listening, noise, distraction and emotional stress. But there are different strategies to overcome from this situation, such as use simple and local languages, active listening, use visual aids, clarify the doubts and show the empathy to the patient. Now, as a community health nurse, how we will give the health education? So health education is actually teaching individuals or group to improve or maintain the health or handling any situation. The methods include individual, which is one-to-one counseling, group, which is include lectures or role play methods, and mass, like using the TV, radio, computer, laptop, mobile. Okay, the media include audio, which are the examples are radio and songs. Visual includes stars, poster, pamphlets and all. Audiovisual includes video and flip charts. Now, a community health nurse, how she will approach in the home visit. The approaches include individual centered, family centered and community centered. So in the family centered care, what are the advantages? There are advantages like it involves the whole family in a decision making. It will promote the sustainable health behavior and build a trust among the community. So if you are going for a home visit, how you will perform the visit? So first you have to do planning for the visit, for which you want to go. You have to choose the topic in which you want to assess the patient, or you will give the health education and all. For that you have to do planning. Then you have to prepare the content, and you have to prepare whatever, like if you are doing a procedure, for the equipments also you have to prepare. Then approach to home. Then we have to go for the assessment intervention, like we will plan according to the situation, and recording and reporting, like after whatever process you have done, you have to record it, and whatever the result have come, you have to report it to the higher authority. And lastly, follow up care up to when the problem is not resolving. So this is the community health approach and home visit. The next one is role of a community health nurse at primary level. The health the sorry. So the main roles include health assessment and diagnosis, MCH services or maternal child health care services, immunization, health education, environmental sanitation, first aid and minor illness care, referral services to the other hospital. Then CHN roles in the health promotion and services include health promotion like lifestyle counseling, then advocacy for the education use, IEC tools, community meetings and all. For the counseling, okay, we use the emotional, family and nutritional related topic. Then immunization. Here we have to ensure the 100% coverage of the national immunization schedule, and we have to maintain the cold chain method of handling the vaccines and all. Then health needs of mother and children. Okay, so the epidemiology says it is a study of disease or pattern in the population. The main aim to do, a main aim to maintain the mother and children is to identify, okay, how we will do the intervention through identifying the causes, determine the disease frequency, develop the prevention strategies. Okay, how we will use it? We will use it through the planning of health services, program evaluation and risk identification. Why it is needed? It is needed to ensure the safe pregnancy and delivery, immunization, nutrition and growth monitoring of the child. Okay, what is the community health nurse role here? So we have to maintain the antenatal and postnatal care with all the recordings and all. Then education to the mothers, immunization of children, detecting high risk pregnancies and monitoring for milestones. Okay, so this is the nurse's role in providing the care to the mother and the child. Next is epidemiological process and use by the community health nurse. So epidemiological process are used in the survey symptoms, trace contacts, educate community, collaborate with the authorities. Okay, so how we will do it? We will do it first. We have to identify the problem, we have to collect the data, then we will form the hypothesis. Okay, or we can also call it as nursing diagnosis. Okay, so we have to form the hypothesis, then test hypothesis, then according to that we have to implement the control measures and we have to evaluate the results. Now in the cases of tuberculosis, of dengue, what we will do? Okay, so the main cause of tuberculosis is Mycobacterium tuberculi. Okay, so it's spread through the airborne droplets or from the infected person if you get contact with them. Okay, then symptoms include cough more than 2 weeks, which is with the purulent sputum. Okay, then weight loss. So these are the main symptoms. Prevention include BCG vaccine, early diagnosis of the patient. The community health nurse role is to provide the DOTS. Okay, DOTS provider. It is a therapy, it is a drug therapy to reduce the symptoms and treat the patient eventually. Then community awareness, we have to increase the community awareness through role playing also, you can say, or through holding a boot camp and all. Okay, so this is the tuberculosis. Next is dengue caused by the dengue virus, okay, which is carried by the Aedes mosquito. So it is spread through the bite of infected Aedes mosquito. The symptoms include high fever, rash and bleeding. How we can prevent it? We can prevent it through the vector control. No suggestion, okay, stagnation is needed. Okay, then as a community health nurse we can go for fogging, coordination and educating the families. Then 2 national health programs, which is RNTCP and NACP. Okay, so actually RNTCP is Rural National Tuberculosis Control Program. Okay, so this is now a 2 part of NTEP. The goal of this program is to eliminate the tuberculosis, and the strategies include DOTS treatment, free treatment, and community care. The NSA base mainly their goal is to reduce the HIV spread. The strategies are free ART awareness and condom promotion. Okay, so that the STD diseases will be prevented. The non-communicable disease, the CHN roles are the common NCDs or common non-communicable disease include diabetes, hypertension, cancer. Okay, so the risk factors are smoking, obesity, and sedentary life. So as a community health nurse, we can do the screening in the camps, lifestyle modification and counseling, and lastly awareness programs. The national program to control diabetes, diabetes and cancer. And what are the CHN roles? So the objectives include the early detection, the manage of NCDs, and promote the health behaviors. What are the components it include? It includes screening at the HWCS, referral services, and health promotion. The CHN contributes, or the community health nurse contribute, door-to-door screening, like we have to do the home visits, referring at risk cases, and educating on diet and exercise. Now school health services lastly. So what are the school health services? So see, school health services are such a thing which are healthcare, the basic level of healthcare and basic level of assessment and health education that we are giving in schools. Okay, the components includes health checkup, immunization, sanitation inspection, health education, and midday meal monitoring. The community health nurse role is to conduct the screening, identify at-risk children, coordinate with the teachers, provide first aid, and promote the hygiene education. Okay. Our next question is list and explain the 5 principles of community health nursing. First one is equity in healthcare. We have to treat all the patients equally. Community participation, we have to encourage the community to participate in program actively. Prevention of overcure. So prevention over cure, like before providing the care, we have to ensure that they are well vaccinated, okay, and they are maintaining hygiene, so the disease will be prevented. Then intercoastal coordination with the with the NGOs, with the locals, okay. Then using the appropriate technology. Along with that, we can emphasize on continuity of the care. Now explain the concept of primary health care and essential elements as per Alma Ata. Okay, so the essential elements that needed in primary health care are health education, nutrition promotion, safe water and sanitation, maternal and child health care, immunization, disease control, essential drug supply, and treatment of common disease and injuries. Discuss the role of NGOs in healthcare delivery in India. So what a NGO, okay, how a NGO play roles in healthcare delivery system of India. Okay, so they are the supplement government programs. They do the supplement government programs, provide services in hard to search areas, okay, where the government can't reach, okay, or where the healthcare facility is not that much good. Then community mobilization, health education and awareness, example as ACWA or SIVA, Child and Need Institute, etc. Okay. Our next question is explain the function of community health center. So we have already heard, so nothing there to discuss. Acts on referrals for the PHC, provide specialist service, OBG, medicine, pediatric surgeries, minor surgeries, institutional deliveries, basic lab and radiology services, family planning and immunization. Next is safe and adequate water supply importance. So why safe water supply importance is needed? To prevent the waterborne diseases and to maintain the water quality and avoid the water pollution, to promote the hygiene and sanitation of the water and for the personnel as well. Then essential for food safety, because with water we cook so many things, right? We used to wash also, okay, our vessels and our vegetables, meat, whatever is there. Then support the overall community health required for safe childbirth and personal care. Air pollution affects and the control measures. Okay, how air pollution affects on the health? It causes respiratory problems such as asthma, COPD, bronchitis and all. Cardiovascular, it increases the cardiovascular risk, and it also increases the eye and skin irritation. Okay, the person especially with dust allergy, they suffer a lot through this. Now how we will control it? We can control it to reduce the fossil fuel use the cleaner fuels, and also the urban greenery and the zoning is very much important to avoid the air pollution. Next is protein energy malnutrition. The causes include inadequate food intake, infections such as diarrhea or tuberculosis, poor weaning practices. Okay, so what are the symptoms of protein energy malnutrition? Wasting of muscle, stunt growth, edema or kwashiorkor, okay, hair and skin changes and irritability. Now principles of good housing for health. So to maintain a good housing health, okay, what we have to do, we have to keep adequate space and ventilation, maintain the safe water and safe waste disposal, protection from the vectors and the damp, proper lighting, structural safety and more. Okay, so these are the main principles of maintaining the good housing. The next one is vitamin A, which is the role and deficiency disorder. The role of vitamin A vitamin A's roles which he play in our body is for the vision, immune function, epithelial integrity. So how this deficiency, so if we got a deficiency, vitamin A deficiency in our body, we can go through night blindness, bitter spot and xerophthalmia. Okay, how we can prevent it? We can prevent it through the supplementation in the children, diet in green leafy vegetables, livers and providing eggs. Nutritional and iron or initiate the NIP's brief overview. So the government initiate to combat for the anemia. Okay, the weekly iron folic acid tablets is provided to the children, adolescent, pregnant and lactating women. There also it will be giving a health education about the deworming and giving the normal or diet planning education. Then the main target of this is to 6 months to 49 years of females and 5 to 19 years of male. Our next condition is effective of communication in community health nursing practice. We have to build the trust and support, enhance the patient compliance, facilitates the behavioral changes. Key tools will be active listening, empathy and use audio-visual aids. Okay. The 3 levels of prevention with examples are primary, secondary, tertiary. In the tertiary, we have to go for rehabilitation. In the secondary, we can go for early detection and BP screening. Okay, example is BP screening and all. For the primary health promotion, we can give the immunization. Okay. Or we can use the personal protective equipment also. The community health nurse as an advocate for the community, what she will do as an advocate? She can represents the community in the health planning, sources, secures access and services or resources, ensure the equity and the right based approach and support the vulnerable groups such as elderly, women and children. Next come to the short questions. Okay, so define community health. So we have already heard community health is a branch of public health that focuses on the physical, mental, social well-being of the people and defined in a well-defined geographical area through the organized effort, health services and public participation. Now WHO definition of health is a state of complete mental, physical, social well-being and not merely absence of any disease or infirmity. So there are 3 levels of healthcare in India: primary, secondary, tertiary. Significance of primary healthcare include provides the accessible and affordable community-based care, focused on the preventional and health promotion, reduce the burden on higher level of facilities. 2 diseases that caused by contaminated water: diarrhea, typhoid, okay, or cholera also. Then biochemical waste. What is the meaning of biochemical waste? So it is the waste that refers to any waste that generated during the diagnosis, treatment or immunization of humans or animals, including sharps, body fluids and infected Materials. There are two methods of solid waste disposal that are incineration and sanitary landfilling. Next question is two methods of anthropometric assessment. We can do through the mid-arm circumference assessment and body mass index. The causes of night blindness is deficiency of vitamin A. The two essential micronutrients in our body are needed in iron and iodine. Two types of communications are there, verbal and non-verbal communication. Two methods of already we have heard. Okay. The next is examples of barrier to communication are language difference between the nurse and the patient, physical problem, mental problem and all. Two health education methods are lecture methods and group discussion. The secondary prevention is actually defined as the action that aimed at early detection and prompt treatment of disease to prevent the complications such as cancer screening. Two common communicable diseases include tuberculosis and dengue. So that's it for today, guys. I have discussed the most important question and I have tried to cover all of the your syllabus. From this only the question will come. If you want a short review, you can go through it, you can increase the speed or decrease it, whatever you want. Okay, so be prepared for the examination. Best of luck. See you in the next session, guys. Till then, keep learning and keep exploring with easiness. Thank you.